welcome to After Hours, On Call After Hours with Mike Bacharach, the show on vascular disease tonight. We just didn't get to all the questions, so we're going to fly through them right now. Mike, you mind doing this?
No, that's great.
All right, some from Ravillo, I think, by Millbank. Swollen legs, feet, what is causing this on blood pressure medicines?
Well, typically swollen legs implies that there's too much fluid there, so it's hard to know. Certainly, there are a number of different reasons. Perhaps the heart's not functioning as well as it should. They may need to be on medication, diuretic medication, that sort of thing. And it can be venous, in what we call venous insufficiency, or they're just spending too much time with their legs down. So, yeah.
A lot of those things could be Norvasc or amlodipine too.
Right. There are some medications that will also contribute. That's right.
Right. Sioux Falls, when do you decide to use defibrillation when you have atrial fib? So people who have irregular rhythm called atrial fib, sometimes you can shock it back into a normal rhythm. When do you do that?
Right. So, I have some electrophysiologic partners who are
they do
perhaps right. They do most of that. But I can tell you this: that we know that people can live normally with atrial fibrillation as long as the rate is controlled. Obviously, if the upper chambers are working in concert with the lower chambers, that's sort of ideal. So in a setting where we think that they will do better or they'll feel better, then often trying to get them back into what we call normal sinus rhythm is advantageous. And in some cases, it has to do with stroke risk, and keeping them on anticoagulation. So if we can get them out of the atrial fibrillation over a long enough period of time. So, but it's complicated, and it keeps, again, it's a moving target. It keeps changing.
Yeah. Come see, come saw, though. Some people say just rate control, as you said earlier. Both of them need to be anticoagulated.
That's right.
Yep.
And in general, if you can. Well, everybody responds differently, so I think that's the...
Depend on your doctor.
Yeah, that's right.
Somebody from Woonsocket called and asked about, is it good to raise your legs and put your feet up when you're sitting back and watching TV or whatever? Do you like the idea of elevating your legs?
Well, I do, especially in patients who have some leg swelling or perhaps they have some varicosities. Why give gravity the advantage to bring that fluid down to your feet, to elevate your legs? But again, they need to be close to the level of your heart. So if they're just on an ottoman or a footstool, that's generally not high enough.
You can really dump the fluid out of your legs, though, if you lay on the couch and put it way up.
You can.
How about explaining regurgitation of heart valves?
Well, regurgitation means that the valve leaks. So when as the heart chamber pumps, it pushes the blood out, and depends on the right or left side, but it's similar. And that as that valve opens, as the blood ejected, and that's supposed to close and not let that blood flow fall back into whichever chamber. So whether it's the right ventricle, left ventricle, or back into the atrium, so for example. So typically, any time that the valve leaks, that's called a regurgitant or insufficient valve. And depending on where that is, whether it's on the right side of the heart, whether it's on the left side on the heart, whether it involves the upper chamber or the lower chamber, that determines what sort of symptoms someone's going to have. So it basically means that the valve is leaking.
Leaking backwards.
Right.
Sioux Falls, caller has had two heart bypass surgeries, has diabetes, leg cramps, legs are cold. Is this related to her surgery? Leg cramps, cold legs, 2 bypass surgeries. Is it the bypass surgery that's the cause of it?
Well, again, we need a little bit more information, but one of the frequent misconceptions is that they take vein out of the leg to do the bypass. And the vein does not, when you remove the vein, most patients tolerate that just fine. They may have some leg swelling, but they shouldn't have decreased temperature or decreased blood flow into the leg. So if she has hardening of the arteries with blockage in the blood vessels
then it might be
the legs as well. So a couple of different reasons why that could be the case.
Check it out, yeah. Sioux Falls, does aspirin help with prevention of heart disease? Heart issues?
Yeah, so that's a moving target. It's become very controversial. There was a time when we accepted blindly that aspirin was a benefit and that it prevented heart attacks and strokes. We then began to realize that from a primary preventive standpoint, meaning if you didn't have any disease, it may not be all as helpful as we thought, but if you had disease and you had already had a heart attack or a stroke, that then putting on aspirin was of benefit. And there are clearly studies out there that the antiplatelet trialists and lots of multi-center trials that have looked at this suggesting that aspirin's benefit. Again, recent data now has brought all of that back around, and so there's some real controversy. I still put my patients, certainly most of my patients have disease. So as a secondary preventive measure, I put them on aspirin. And so I think that there's a benefit, and I look at some of the older data and support that.
Yep. And it's just about as good as Plavix, and just as good as Agrinox. I mean, they're just about the same, maybe just a little bit.
Right, a little bit different.
And a huge cost difference.
Right. And now again, with coronary stents, that's a different ballgame. That's something where Plavix is generally needed. But.
All right. I have to say that I also like to use baby aspirin to prevent colon polyps. And when there's known colon polyps, I'll throw that in.
Does it work?
Oh, it works. It's much better than a full aspirin, and it's clearly better than fiber or any other treatment, a baby aspirin for colon polyps.
All right.
Sioux Falls, he thinks you look younger without your facial hair.
Is that you or me?
That was me.
Okay.
He drinks 3 pots of coffee a day. Is there a problem with 3 pots of coffee a day?
I think the key to most things is moderation. 3 pots sounds like a little bit much to me. Now maybe a couple of them are decaf, but again, moderation is probably And again, there's data out there that suggests that coffee in moderation is not harmful to you.
How about a glass of wine?
Well, there's data out there that suggests that, in fact, alcohol in moderation is, in fact, good for you by raising your HDL cholesterol. So, and some of the tannins in red wine, for example. But, so I don't want to go on your show and say, oh, yeah, we advocate that you should drink. But,
because some people have problems with
that's
drinking.
right.
But if it isn't a problem for you, it's probably...
Right. Again, in moderation. But moderation's,
there's an edge.
Yeah, an ounce or, or 2 a day. It's not a
I had a lady,
I
said a glass of wine a day, and she ended up a bottle of wine a day, and it was a bottle and a half of wine, and then it moved to brandy, and the family got all over me on that.
Yeah, it's a little much.
79-year-old person called weakness in legs, dizziness, 3 years, West Nile last summer. Anything I can do to decrease my symptoms? Ooh.
Well, it's a complicated situation, one in which there are multiple potential issues and reasons why they may have some trouble. Weakness in the legs can be caused certainly by blockage in the leg blood vessel, but it can also be caused by neurologic problems, by spinal stenosis. There are many different things.
Too many to say, and the West Nile virus may have had something
to do.
But,
basic good medical examination can ferret a lot of that out by feeling whether they have pulses, trying to determine when the leg weakness occurs, what makes it better, what makes it worse. And there's a lot of information. You don't need fancy scans and things necessarily to at least get an idea of what might be going on.
A good exam and a good history by a good clinician will make a huge difference for people, and we undervalue that, and we overvalue technology when we should be doing more. You agree with me on that?
I think you're right.
Rock Valley, pain between shoulder blades, massage therapists won't touch. Could this be dangerous? They're worried about the back pain of dissecting aneurysm.
Well, that's certainly dissecting aneurysms where you have a portion of the wall of the inner wall of the blood vessel separates. It doesn't bleed out, but stays within the confines of the blood vessel, but dissects. Certainly can cause that. But remember that, blockage in the circumflex artery of the heart often is transmitted to the back, to the shoulder blades. So,
and gallbladder disease.
Well, that's right. So there's a number of different things that could be, and it could be just musculoskeletal. So,
yeah.
Again, a good history, trying to determine what brings it on, what makes it better, what makes it worse. And, if the patient collects that information and provides it to their doctor, that can be a huge help.
Yeah. Discuss relationship between low blood pressure and salt intake. If you have low blood pressure or low sodium, do you restrict salt intake?
Well, no, and there certainly have been advocates, and again, I'm not an expert on this, but there are patients who have low blood pressure, perhaps because their volume is low, and so as a result, taking some extra salt and fluid may be good for them. There are some autonomic dysfunction, a thing called Scheidegger syndrome, that where in fact taking fluid or even taking medication that has you hold on to fluid, Florinef, would be beneficial.
Right.
But those are relatively infrequent. Those are rare cases.
Parkinson's sometimes.
So
Yep.
yeah.
500 to 600 PVCs each day, is that dangerous?
No.
No. Gregory, blood clots twice and a stroke. How safe is blood thinner for the long term? A non-physician tried to help her neck and move the clot to her brain. That's interesting.
Well, so that's, again, complicated. Remember that for garden variety strokes and for blockage even in the carotid arteries, Coumadin and blood thinner have not been shown to be of benefit.
Aspirin?
Aspirin and some of the antiplatelet agents, in some cases Plavix or Agrinox, have been shown to be beneficial. Now that's different if you have a blood clot that came from the heart, for example, because they have atrial fibrillation or valvular heart disease. Those patients do benefit from being on blood thinner. So it's complicated. Right? You need to really understand what's causing it.
Varicose veins, 8 years ago, had surgery. One leg is much larger than the other. It's black. It hurts.
Yeah, I would advise that patient to get in and see somebody because that's not normal. Certainly, when you say black, it may be discolored because they have venous congestion.
Yeah.
And remember, the venous blood is darker in color, it's bluer, so you get a violaceous discoloration. It may not be truly black. If it's truly black, they need to get in and see somebody.
Right. And could be rusty too as well.
Right.
I think support hose on those, but you got to be careful because tight support hose can be compromising a person whose arteries are.
I honestly, I think that, you have to really put compressive support stockings. I mean, someone who has severe arterial occlusive disease, but for even the garden variety who have modest disease, they do fine with spike. Remember, you're only looking at 20 or 30 millimeters of compression. If their blood pressure is, say, 130 or 140, it may be diminished, but even then down the leg, it's going to be 75 or 80, whatever. So, yeah.
Rapid City cardiologist, Marfan syndrome, family, female versus male. What is Marfan's?
Well, Marfan's is what's called an aortopathy. It is a genetic disorder that's associated with lax joints, some subluxation of the lens of the eye, and some unique characteristics. Many people think that Abraham Lincoln may have been Marfanoid.
Yeah.
So what happens is those patients have some genetic defect in their large blood vessels, and so they are at risk for developing aneurysms and dissections, and makes them genetically very vulnerable. So we now understand a great deal more about those entities. We know that Marfan's is just one of them, and there's many others, and not everyone needs to look funny.
Skinny.
That's right. They needs to, look different.
Like Babe Lincoln.
Right. So the big issue there is if you've been diagnosed with Marfan's, you are at risk for those things, and really you need genetic counseling. You really need to get genetic counseling to determine
whether you're going to have babies,
whether you're going to have offspring, what the risk of the offspring are to developing. These are serious disorders that often result in premature death and significant disability.
And there's not much we can do.
No. I mean, we operate on some of those patients, but and they need surveillance. They need much closer follow-up than a patient who's normal.
Pacemaker placed in '99, need battery replaced in 2 years. Will that need to replace the leads?
No, not typically.
Yeah.
Again, there have been lead recalls. There are other problems. I don't know all the information, but generally the power pack or the pacemaker actually can be replaced. You can use the same leads.
Right.
Unless it needs to be reconfigured, or unless it's an old style one that would need you put a second lead in. Again, I have some electrical partners that are far more expert at it than I am.
But they do put a whole new pacemaker. They don't put in little new.
No, they don't put a battery. No, they put a whole new pack.
Do you recommend Coumadin? What side effects? We already addressed that. What should blood pressure after a heart attack be?
Well, the current guidelines for blood pressure are really pretty much the same for everyone. So I wouldn't say that they need to be specifically reduced or allowed to be higher for someone who's had a myocardial infarction. Again, the big thing is that you want it to be controlled, and you want to avoid hypertension. So.
Okay. Hot springs, how valuable is the screening test for calcium in the blood? or calcium CAT scans to look for vascular disease of the heart?
Again, very controversial. Honestly, you know, getting a sense of what their exertional capacity is, that sort of thing, their functional.
A stress test is a better.
Right, I think so. Again, there are some situations where some of these fancy CTs, coronary CTs, can be helpful. Certainly in some of the young people who you think are very high risk, and you'll convince them to perhaps change their lifestyle. But it's
a lot of X-ray for the
hard to know. That's right.
High cholesterol, what can be done? Are you a person who believes that the high cholesterol needs to be treated, or do you use statins for no matter what the cholesterol is, or how important in your mind is the statin compared to the rest of the things that we can do?
Well, you know, statins are truly remarkable medications, and they've had a huge impact. So despite the fact that they've been maligned because people have leg pain and the myopathy sort of, but the fact is they've had a huge benefit to many thousands, tens of thousands of patients, reducing their risk of myocardial infarction, stabilizing plaque. They have a benefit in reducing stroke. So they really are a marvel of modern pharmacology. Now, that doesn't mean that everyone should be on a statin, and it doesn't mean that you still shouldn't be prudent about your diet, that you should lose weight, that you should change your eating habits, that much can be done. Increasing fiber in your diet. All of those things can be a benefit. And if you can do it non-pharmacologically, that's great. There are also some small particles that may not benefit as much from statins. So there's still some genetic dyslipidemias that we don't really have, that we don't really fully understand. We know that exercise increases HDL. Not smoking increases HDL. Those are very important particles as well, those high-density lipoproteins that take the fat out of the blood vessel, taking it back to the liver for processing. So, you know, it's you start with diet, you do the exercise, increase fiber, and then you add those medications as needed. Some people, you have to start on the statin right away, but...
Certainly those with heart disease is appropriate. The question is, does it really prevent heart disease in people who haven't had a heart attack? And there's a fair amount of controversy on that. How much effect with how much side effect and cost? Right. Here's a question from someone. I have had an EKG panel, chest x-ray, CAT scan, 2.7 centimeter mass on the top of my left kidney, encapsulated. It doesn't involve any veins or arteries or adrenal gland. It will be removed in a few weeks. There's a 99% chance it will be malignant. However, I still have no answers as to what could be causing the feeling in my chest. Some days it's more noticeable, and others there's no pain, just a grating, grinding feeling. There are some calcium deposits on the ribs and sternum that show on the scans. I'm a 61-year-old farmer. What do you think?
Well, I tell you, that's a, you know, it's a tough question. You know, certainly it sounds like the patient's getting appropriate care for that renal mass, and that needs to be taken care of. You know, again, there's a wide variety of causes for chest discomfort, some of which is just mechanical, can be involvement of inflammation of the costochondritis, of the cartilaginous structures in the chest wall. He may do a fair amount of physical work, and so some of that may be early arthritic changes.
Certainly, he's sensitive right now because, oh my gosh, there's something wrong, and he feels every little nuance.
Certainly. I mean, you worry about heart disease. You worry about all those things, and I think that, again, this is where it's very helpful to kind of keep a diary and say, okay, what brings on the discomfort? Does it happen when I'm watching television or when I'm climbing steps? Because there's a big difference. What makes it better? What makes it worse? What do I do to make it go away? And so that when he does see his practitioner, he can tell him or her and say, gee, every time I walk up steps or every time I'm carrying a feed bag, I get chest pain. That's different than, well, I watch television, I get chest discomfort, but it's fleeting and it goes away right away. Right. You know, that's a whole different...
Is it related to food? Is it related to breathing? All those, that history is so important.
It is, right.
One more question. Okay. The final question.
All right.
What effect does Viagra do to your veins?
That's a good question.
It is.
Yeah, so sildenafil is a potent vasodilator, okay? And
it's an arterial dilator.
It's an arterial dilator, not a venous dilator. And you know, originally it was designed to be an anti-anginal.
Right.
And when they tried to get those pills back from their test subjects, they didn't want to give them back. That's right. So But it wasn't very potent as an anti-anginal, but obviously it works for erectile dysfunction. It really shouldn't affect the veins, but it will affect and the reason for that is that the veins don't have really any significant amount of smooth muscle. The arterial walls have smooth muscle that then responds to the vasodilatory effect of it, and of course that's what allows then the improvement in blood flow to the penis.
It's a good thing. The problem is you don't want to have that on board and then have a heart attack and take nitroglycerin.
Right, if you take nitroglycerin and vasodilate, then all of a sudden your blood pressure is low. Now, some of those medications, you know, Cialis and so on, will cause low blood pressure, and I presume if you know, the reason I mentioned Cialis is because there's a daily variety that you can take on a daily basis.
And the blood pressure lowers.
Right.
Could lower your blood pressure. And improve your urine flow. There's all sorts of...
Yeah,
that's what they're...
as opposed to Flomax. Right?
Yep, great. Well, thank you very much for helping.
Thanks, Rick. Thanks for having me. It's really been a pleasure.
Thank you.
Appreciate it.
And thank you for listening, and stay healthy out there, people.